Alrighty, hi, I am student nurse Emily. Today I will be doing a dressing change on my skills trainer. This is the wound. So the first thing that I'm going to do is check my orders, make sure that my patient is supposed to get a dressing change. If they have PRN dressing change orders, I would need to check my patient's dressing beforehand, make sure that it needs to be changed. Sometimes it's every day, whatever. So I would gather my supplies. I have a dressing change tray. In addition to this, it depends on what you are cleaning the wound with. So per se, I would use saline, regular saline for this. I do not have that in this kit, but that is what I would be using for the wet to dry portion of the change. So the first thing that I'm going to do is I'm going to enter my patient's room, wash my hands, introduce myself to the patient, screen for privacy, educate the patient on what I'll be doing, and a dressing change. Sometimes the patient may have pain medications ordered that you're supposed to administer probably 30-45 minutes before you do this dressing change, just in case it is painful. And then I would raise the bed to a working height for myself. So I'm going to take my kit out. Again, I can use this as trash if needed. It's always useful to use this as trash and just put it close to you because these are sterile procedures and you don't want to break sterility. All right, so here is my kit. Open away from me using the 1-inch border. Away from me, away from me. Actually, and I do not have sterile gloves in this kit, so that's interesting. Trying to see if I can find some real quick. All right, so here's sterile gloves. So usually these would be placed inside here. I'm going to use the claw and push them aside. This would usually be used to place underneath the wound, but given how these boxes are made, I don't need this. I can still show you how I'd open it using the 1-inch borders, shiny side down, and then you would just put this underneath your patient. So I'm gonna fold this back up because I can't use this for my demonstration. Alrighty. And then the next thing that I'm going to do is I'm literally just going to take the outside of this tray and dump it over. Staying within my 1-inch border. The gauze didn't come out. Okay. Now I would put clean gloves on. Oh, my gloves are at the bottom. Okay. So at this point I would put clean gloves on because I'm going to remove the old dressing on this. When I remove the old dressing on this, this is when I'm going to assess the wound. So with clean gloves, I would take off the dressing. At this point, I would assess the wound, and then I could measure this wound with a cotton swab, and you would need a ruler. And you can also do that with your sterile gloves. You just have to make sure that you toss everything that has touched the wound. So at this point, I would take off my clean gloves and don sterile gloves. So I can do that right here. Alrighty. Again, I don't have a lot of space for this. So these, I'm going to show you how I would put my sterile gloves on, but then I'm going to have to toss the paper out of my way. And they were put in upside down. So, alright. So right hand first. And one of my fingers is messed up, but that's okay because I can fix it once my other glove is on. Can't fix it if all my fingers get messed up. All right. There we go. And at this point I can put the gloves together and adjust my fingers and pull down like that. All right. So my sterile gloves are now on. I'm going to remove this out of the way, but again, this would not be sterile. Okay, so Saline would come in here, so I would put saline in 2 of these. Make sure that I have all the supplies that I need. There's tweezers in here. There's another packing for the dressing. Here's alcohol swabs and another alcohol swab. There is no ruler in here, but you would need to make sure that you got a ruler to measure. Okay, and then here's my gauze that I would use to pack. So at this point in the process, I'm just kind of getting everything ready. So can't touch my face. I wouldn't have done that at all. So I can, if I need to measure, I would stick this in here. I would check for things like tunneling, any kind of necrosis, color, odor. I would measure the depth, the width, the length, all of that, and make sure that it's charted, because if there's any kind of change in the wound, that the healthcare provider would need to know. You'd also check for things like dehiscence and evisceration. So, I don't need these. So the first thing that I'm going to do is prepare my gauze by soaking it in the normal saline, depending on how many pieces I need. Because my hands are sterile, I can also roll this up, given that this wound is very long in length and not very deep. So you just want to adjust the gauze depending on how your wound is. So this looks like it would fit my wound pretty well. At this point, I'm going to soak it, and then once it's soaked, I can pack it into the wound, but only touching the outside. I don't want to touch the inside, because if I do that, then these are no longer sterile. And then, so that looks like pretty perfect length for what this wound is. I can put these aside. And then at this point, I would start dressing my wound back up. So this could be cut. It would need to be cut for this, because it completely covers over, but I'm not going to cut this. But this would be cut, or I could put it like this. And this is dry, so that's how it's a wet to dry, because you're putting wet gauze and then you're going to cover it with a dry one. And then at this point I would tape it. So on this dressing, I would also put my date, time, and initials, because I am the one who did this procedure. And then I could tape, and my patient would be good to go. While I'm doing my wound dressing, I would make sure that my patient's not in any extreme pain. If you're taking off an old dressing and it's stuck to your patient's skin and it's going to pull or cause pain to your patient, you can add saline to loosen that dressing. Also, if you are using saline that has been opened before, you would need to dip some out, so that it's a clean solution going onto your dressing. Other than that, I think that's about it. Here is my patient's dressing. Again, this is a very small surface to cover and very large material. So that's it. Thank you.